Good morning. I'm Dr. Cynthia Clark, acupuncture physician, applied clinical nutritionist, qigong and tai chi instructor, and medical qigong practitioner. And what I'd like to share with you today is a morning routine that helps to boost your qi and also to strengthen your immunities. Today we're going to be focusing specifically on the lungs. So if you would please join me, the first thing that we're going to do is we're going to drop down, we're going to lift up. As the lungs fill with air, you're going to shift your hands and you're going to push directly out. When you get to full extension here, you're going to shift, bring in again, and exhale as you push down. And again. Good morning, Faye. It's so good to see you. Very likely as you do this, you'll start to notice yourself getting a little hot. That means you're doing it right. Good job. Now, as you breathe in, arms come back. As you exhale, arms push down. As you breathe in, and tailbone tips under a little bit here. Breathe out. Breathe in. Tailbone tips back. Breathe out. Soft knees and relax into this. We're going to do this several more times. This is a great way to get the qi flowing. Good, and again, as you breathe in, what you're doing here is you're breathing air deep into your lungs, and the direction of the lungs is to disperse energy and qi out. So we see a Wei qi filter, which is your immunity that runs around all your body, your entire energy field of your body. And you're filling that up with good, clear, pure energy right now. Good, 2 more times. And last one. Excellent, excellent. Now we're going to give some little twists. So you're just going to be rotating. And as you do this, you're going to allow your arms to just loosely land where they may. Gently tapping. We're starting to increase circulation here throughout the girdling vessel. This is also called the Dai channel in Chinese medicine, which for us Westerners can be quite alarming if we hear we have a problem in our Dai channel and we don't know what that means. The word is D-A-I, and it means girdling vessel. This is the meridian that runs around the center of our body. It's also called the belt meridian. All of the other meridians in the body, they all run vertically up and down, but the girdling vessel runs left and right. So as you do this, then your arms are going to start to rise up and you're going to get a little bit more movement. You're going to get a little bit more elevation. You're also going to get a little bit more vigorous. We're going to start to tap a little bit harder. Here in the back of your wrist will wind up hitting your kidneys as you come around. And the front hand is going to be hitting your shoulders. Now these are all points on your acupuncture meridians. In fact, you're on your lung and your large intestine channel right here. And then we're going to get a little bit more specific. There's a point right in the triangle that's formed when you raise your arm. This is called lung 1. And now as you turn, I want you to let yourself knock on that door. Knock on the door of lung 1. Help to increase circulation to the lungs and at the same time increase circulation to the kidneys. One of the pattern differentiations for asthma is for the lungs failing to grasp the kidney qi, or in more chronic conditions like COPD, lungs failing to grasp the kidney qi. And so this is a powerful way to start allowing your body to make those connections together. Now, after you've done this for a little bit, you're going to shift and you're going to allow yourself to hit this spot right below your clavicle. Right here, that's on the stomach channel. Many lung disorders come from a lack of drainage in the stomach channel and in the bladder channel, in the kidney channel. The stomach, the kidney, the stomach, the bladder, and the gallbladder channel are the primary drainage channels of the body. So as you do this, you're signaling to your body, okay, we're ready to release, we're ready to let go, and we're bringing blood flow to those important points. Realize this is also where we're starting to get to the point that your lungs are closest to the surface of your skin. Next, we're going to come up and over the top. Now we're on to the gallbladder channel. And we just want to relax a little bit. Relax into the gallbladder channel. This not only is a drainage channel, not only drainage points, but these are the points that are responsible for increasing blood flow to the head, the neck, the shoulders. These are the points responsible for good decision making. So if you've been having trouble making decisions or making good decisions, then this is a great qigong exercise to do. Now these are the basics and these are the warm-ups. Just keep going here because it's so nice, right? Sometimes we feel like we have the weight of the world on our shoulders. It's easy to feel that way. And this is one of the things you can do to help increase circulation, hopefully to let the world go. But if you can't do that, then at least make yourself stronger so that you can carry it. Couple more times. Good, then we're going to come back down to the stomach channel. Just allowing yourself to gently flow. And then back down, letting it all relax. Back down to the hips. So easy for our hips to get congested. The meridian that runs down the side of our body is called the gallbladder meridian. And it's made, our bodies are made to work best when we're in a standing position. However, in 21st century America, most of us sit. I mean, we even sit to go places. We get into our cars or we get on a bus or we get onto the train or the plane even, and we sit. And because of that, we wind up with a lot of congestion in our hips. Okay, so now that you've done that, we're gonna start some tapping that's gonna go down the sides of your legs through the gallbladder channel. And then, so gently, so you're just making little cups right here. Gently tap all the way down the sides of the legs. And then back up on the insides of the legs, up to right in front of the hips. So there's a little bony protuberance right there called the ASIS, the anterior superior iliac spine. And then you're gonna come back around to like the tops of the buttocks, down the sides of your legs, down, 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 down. And then up the insides of your legs, increasing that circulation. Again, right up there in front, those ASIS points. These are kind of like, your hands are going to be hitting the inguinal crease. One more time. Down the sides. Really let that clap. Really get in there. Increase that circulation. Yeah, you should be nice and warmed up now. Nice and warmed up. Okay, the next set of exercises that we're going to do are very specific for strengthening the lungs. And it goes like this. The first thing that I want to teach you is, you remember lung 1, this meridian that you just said, the lung meridian goes from lung 1 here, all the way down the inside of the arm on the upper part, and then down through the arm, all the way out to the thumb. So that's the lung meridian. The mudra that we're going to do is called the twisting tiger tail. And here's how you do that. You're going to do this on both sides. So you're going to take your hands, and for you Star Trek fans out there, remember this one? Okay, so you're going to come into this position, and then those 4th and 5th fingers are going to come down. I know it can be a little bit tricky at first. 4th and 5th fingers are going to come down. Good. You can relax now. We're going to come back to that in just a moment. The first thing that you're going to do is arms are going to come out, and you're going to pull those fingertips back in order to fill your body with chi. So you're just going to pull those fingertips back and create a little bit of isometric tension, keeping the fingertips pulled back. Good. 3, 2, 1. Okay, great. And now you're going to go into that twisting tiger tail mudra. So with your fingertips pulled back, just let the 4th and 5th fingers drop down so that they're 90 degrees from where they were before. And now you're just going to let arms come in. The 4th and 5th fingers are going to point directly at that lung 1 space. And then we hold here, and we're going to breathe in through the belly. Hold. Out for a count of 6. And hold for 2. In for a count of 4. Hold for 4. Out for a count of 6. Hold for 2. We're going to do this 9 times total. In for a count of 4. Hold for 4. Out for a count of 4. Out for a count of 6. Hold for 2. In for a count of 4. Nice, deep, beautiful breaths in through the belly. Hold for 4. Out for 6. Hold for 2. In for 4. Hold for 4. Out for 6. Hold for 2. In for 4. Hold for 4. Out for 6. Hold for 2. In for 4. Hold for 4. Out for 6. Hold for 2. In for 4. Hold for 4. Out out for 6. Hold for 2. You may feel your chest cavity start to expand more, like it wants to take in more oxygen. That's great. You're doing it right. Hold in for 4. Hold for 4. Out for 6. Hold for 2. In for 4. Hold for 4. Out for 6. Hold for 2. We'll do this one more time. In for 4. Hold for 4. Out for 6. Hold for 2. Now we're going to shift, rotate, push the arms out, rotate hands up, and then drop and flick to release. Excellent. So that was organ qigong. This time, in the next series, we're going to do meridian qigong. So problems on the lungs with the lungs can either happen in the organ or they can happen down the meridian. So we're going to do both of these. So the meridian qigong starts the same way. Arms up, pull fingertips back, and hold to charge. And now 4th and 5th finger are going to come down for twisting tail mudra, just like we just did. Arms are going to come, you're going to step out with your left foot, so it's going to be in an L. And you're going to start with that 4th and 5th finger on the lung meridian on the opposite side. So I'm using my right hand and I'm coming to lung 1 on the left side. And you're going to start here, and you're going to take 9 breaths to come down the entire channel. So it's going to go in, and these can be normal breaths. And you're going to just trace the inside of the elbow, the inside of the shoulder. All the way down the inside of the arm to the wrist. 2 more breaths. And down the thumb. And now you're going to flick to release. Good. Stepping back, and now we're going to do the same thing on the opposite side. Step out right into an L shape. And hands are going to come into twisting tail mudra. Left hand is going to come across to right lung 1. And 9 slow, deep cleansing breaths. Two more breaths. And again, flick to release. Excellent, excellent, excellent. So now we're just going to end with a little bit more of that twisting and tapping, knocking on heavenly door, the gate of the Mingmen, right between your kidneys. Mingmen is right between your kidneys. Your backs of your hands are going to come lovingly tap your kidneys, lovingly tap your mid-back, lovingly tap your shoulders. And now that you know where your lung meridian is, you know why tapping these areas is so powerful. Tap, tap, tap. Excellent, beautiful. And as you're doing this, just think about how your body feels. Think about the invigoration that's taking place, the increase of nutrient flow that's coming, the increase of oxygen that's coming from your blood to your cells. And feel how much your body likes oxygen. Feel how much that's fuel for the cells. Now we're going to drop back down, coming to those points right below the clavicle on the stomach channel. This is stomach 12. Back to lung 1. Letting yourself fully rotate and relax. Beautiful, beautiful, beautiful. And finally, dropping back down and going all the way back to those hips and coming slowly to a stop. Thank you so much for joining me. I hope that you've gotten a great deal out of our time together this morning. I hope you have a beautiful, beautiful, beautiful day. And I hope that you remember to replay this in order to increase your lung qi and increase the strength in your lungs. This is a technique that's being used, Tai Chi and qigong is being used in Chinese hospitals to treat the patients right now. So please enjoy this, make good use of it, share this video with friends and family. You can even have your own little virtual meeting and have everybody do this together. This is a safe, effective, easy way to increase oxygen to your lungs and to your entire body and to increase your immunity this way. So thank you so much. I'm Dr. Cynthia Clark. I'm an acupuncture physician, an applied clinical nutritionist. I'm the creator of Energy Evolution, and I'm the president of Longevity Wellness, and we are here for you. Have a beautiful day.